For decades, the medical establishment has been obsessed with a very narrow big three of health metrics: cholesterol, blood pressure, and blood sugar. Get those three numbers into an acceptable range, and you've supposedly done your due diligence. Meanwhile, the data on what actually predicts healthy, vibrant longevity keeps pointing somewhere else entirely toward muscular strength, the depth of your social relationships, and whether you actually have a reason to get out of bed in the morning. None of these show up on a standard lab panel. None of them generate a prescription. And that's precisely why conventional medicine has largely ignored them for as long as it has. The research here isn't fringe or speculative anymore. It's some of the most robust longevity data we have. Grip strength alone is a better predictor of all-cause mortality in older adults than blood pressure. Loneliness carries a mortality risk comparable to smoking 15 cigarettes a day. And a documented sense of purpose is associated with significantly reduced risk of death from all causes, independent of diet, exercise, and every other lifestyle variable you can name. Yet none of these get a fraction of the airtime your LDL number gets at your annual physical. Funny how that works when one of those things can be treated with a statin and the other three can't be turned into a 30-year patent. If I could replace one single test on the standard geriatric workup, it would be swapping out half the routine blood work for a grip strength dynamometer and a 5-time sit-to-stand test. Muscular strength isn't vanity. It's a direct readout of your metabolic reserve, your neuromuscular integrity, and frankly, your odds of surviving the next decade without a catastrophic fall or hospitalization. This connects directly to the metabolic reserve component of the Wolverine Healing Protocol's 5 M's: microvascular health, mitochondrial health, metabolic balance, metabolic reserve including muscle, and membrane health. Muscle is not just a mechanical structure for moving furniture, it's an active endocrine organ. It secretes myokines that reduce systemic inflammation, improve insulin sensitivity, and even support brain health through crosstalk with the central nervous system. Sarcopenia, the age-related loss of muscle mass and strength, isn't a cosmetic inconvenience of getting older. It's one of the strongest predictors of frailty, hospitalization, and death in the entire aging literature. And yet conventional medicine's approach to an 80-year-old losing muscle mass is often to do nothing, essentially, until they fall and break a hip, at which point they get surgery and a physical therapy referral. That's treating the crash instead of fixing the brakes. Resistance training, even started later in life, produces measurable increases in strength and muscle mass in nearly every population studied, including frail, elderly patients in their 80s and 90s. This isn't a nice to have. This is arguably the single highest leverage, lowest cost intervention in all of longevity medicine, and it requires no pharmaceutical company's involvement whatsoever, which might explain why it doesn't get pushed nearly as hard as it should. Here's a statistic that should stop you in your tracks. Strong social relationships are associated with roughly a 50% reduction in risk of early death, on par with quitting smoking and outpacing the protective effect of regular exercise on its own. Chronic loneliness, on the other hand, is associated with elevated inflammatory markers, impaired immune function, higher rates of cardiovascular disease, and accelerated cognitive decline. Isolation is, biologically speaking, a slow-acting toxin, and yet you will search a standard physical exam form top to bottom and never find a single question about the quality or depth of someone's relationships. Why does this matter physiologically and not just emotionally? Chronic social isolation keeps the body's stress response system, the HPA axis, in a persistently activated state, which drives up cortisol, promotes systemic inflammation, and directly undermines microvascular health and mitochondrial health, 2 more pillars of the 5 M's framework. Chronic stress from isolation is quite literally corroding your cellular machinery from the inside, 1 cortisol spike at a time. Meanwhile, the medical industrial complex has an entire pharmaceutical category in the form of antidepressants and anti-anxiety medications, built around managing the downstream symptoms of a problem that, in many cases, could be meaningfully addressed by something as unglamorous and unpatentable as genuine human connection. There's no drug rep pitching your doctor on have dinner with a friend twice a week, even though the data supporting that intervention is arguably stronger than the data behind half of what's actually being prescribed. Every time researchers study the blue zones, those pockets of the world with disproportionately high numbers of healthy centenarians, places like Okinawa, Sardinia, and Nicoya, a sense of purpose shows up as a consistent thread. The Okinawans even have a word for it, ikigai, roughly translating to the reason you wake up in the morning. Longitudinal studies have found that a strong sense of purpose is associated with a meaningfully reduced risk of mortality, reduced risk of Alzheimer's disease, and better cardiovascular outcomes, independent of every other lifestyle factor researchers control for. Contrast that with the standard trajectory in a lot of modern retirement culture. Work for 45 years, retire, and suddenly have no structure, no role, and no clear reason to get out of bed beyond finishing the crossword. It should surprise nobody that retirement, when it isn't accompanied by some replacement source of purpose, is associated with accelerated cognitive and physical decline in a lot of the research. We built an entire cultural model around relax and do nothing as the reward for a lifetime of work. And it turns out doing nothing is one of the more effective ways to accelerate your own demise. There's a certain dark irony in spending decades saving for a retirement that, absent purpose, may shorten the very years you were saving for. Purpose isn't some abstract, unmeasurable, feel-good concept either. It has real downstream physiological effects, reducing chronic inflammatory load and supporting healthier patterns of behavior around sleep, movement, and diet. Because people who feel like their life has direction tend to actually take care of themselves rather than just going through the motions. It ties back into every one of the 5 M's indirectly, because purpose drives the behaviors that protect metabolic balance, membrane health, and everything else on the list. Motivation is the upstream variable that determines whether someone actually does the resistance training, actually eats the anti-inflammatory diet, actually prioritizes sleep. You can hand someone the perfect longevity protocol on paper, and without a reason to follow through on it, it's worthless. None of this is complicated science. It's just deeply inconvenient for an industry built around billable interventions. You can't put strength training, friendship, and purpose into a pill, an injection, or a surgical procedure, which means there's no marketing budget behind promoting them the way there is behind the next blockbuster drug. Nobody's buying a Super Bowl ad to tell you to call your old college roommate or join a pickup basketball league. But somebody is absolutely buying a Super Bowl ad for the next diabetes drug. This is exactly the disconnect between conventional and progressive longevity thinking. Conventional medicine treats aging as a series of isolated organ-specific failures to be managed with isolated organ-specific drugs. A progressive root cause approach recognizes that strength, connection, and purpose are upstream drivers influencing nearly every one of the 5 M's simultaneously, and that fixing the upstream drivers produces better outcomes than perpetually patching the downstream damage. Start lifting something heavy, consistently, ideally under the guidance of someone who can teach you proper form. Because the injury risk of bad technique is real, but the risk of doing nothing is far greater. Audit your social circle honestly, and ask whether you're actually investing time in relationships or just consuming content in isolation while telling yourself that counts as connection. And get deliberate about purpose, whether that's mentorship, community involvement, a creative pursuit, or continuing meaningful work in some capacity, rather than treating retirement as a finish line instead of a transition. The old big 3 will still get measured at your next physical, and that's fine. Keep an eye on them. But if you actually want to influence how well you age, not just how long you technically survive, put your energy into the new big 3 instead. Your muscles, your relationships, and your sense of purpose are doing more for your longevity than most of what's in your medicine cabinet. And unlike most of what's in your medicine cabinet, none of it comes with side effects. Need help and support? We can assist with strength training and meaningful cardiovascular training using our EWAT protocols. It is up to you to find your purpose and create or maintain meaningful relationships.